Go ahead, sir.
A very good afternoon to all of you. So, welcome to the academic streaming from West. So, myself, Dr. Prasanta Kumar Nayak. I'm a consultant, fertility consultant at Oasis Bhubaneswar branch. So, today we'll be discussing on polycystic ovary syndrome. This is an emerging health issue that mostly leading to infertility and other health issues. So let us discuss about this health condition, and I'll try to explain about the disease and how it is important so far as the infertility is concerned. So at the end of the session, any of you can ask your question, you can type it so that I can answer them. So let us know about polycystic ovary syndrome, PCOS. So all of you must have heard the terminology PCOD, that is polycystic ovarian disease. But the same name nomenclature has been changed as PCOS. It is no more considered as a disease. It is considered as a syndrome, polycystic ovarian syndrome. So this is a condition which is being diagnosed by some investigations and tests. But the nomenclature is derived from the polycystic nature of the ovaries. Ovaries are the organs. We know these are the gonads present in the female body. So when these ovaries become cystic by some characteristic points as we diagnose from the ultrasound, so we call it is as a polycystic ovary syndrome. So it is a condition mostly can be we can attribute it by the presence of abnormal androgen production and metabolism. Also, there is some endocrinological dysfunction, and it is a spectrum of clinical and morphological findings or presentations what we see. And it is polygenic and multifactorial. If you'll ask me what are the actual etiology or what is the actual cause of polycystic ovary syndrome, then I may not explain it correctly for a single cause or etiology, because so many factors are responsible for it, and there are some genetic influence also. So it is known as multifactorial and polygenic condition. To simplify, I can tell that there are so many conditions or so many factors, not exactly one cause, which is responsible for the syndrome, that is polycystic ovary syndrome. So some of the highlights about the disease. This is the most common endocrinopathy in reproductive age group. Means in a female reproductive age group means between 15 to 45 age group. Out of all the endocrinological disorders, it is the most common. It is associated with infertility. One of the very common presentation of this disease is that it produces infertility, so that the female cannot have a child as usually otherwise occur. So CC requires some treatment and all. It also being expressed with hyperandrogenism features, like it produces a lot of hair growth and androgenic features in the female body along with hirsutism. And if you'll see the prevalence, means how many people suffer from this disease, then we'll see that it is up to 50% as so far as the Asian populations, means South Asian populations where India is also a part. So the prevalence in our country and our neighborhoods are very very high. And it has been found that the people which we have already diagnosed, there are still 70% of the people who are not diagnosed. So if you'll see the actual prevalence, it is very very high. And not only it has a difficulty in diagnosis, but also a variable presentation, as I told. So now let us solve the queries related to this disease. That will be more easier, I think, after the brief description about the disease. So people must be asking that how common this PCOS in our practice. Means if I have a doctor, I'm answering you that how frequently we find the conditions like polycystic ovary syndrome, then I must say that it is the prevalence varies from population to population, but worldwide prevalence is 5 to 15%. In India, if you will see, it has some of the researchers has found it up to the level of 22.5%, and it can be as high as 36% also. That means you can imagine, means it is among the adolescents or even the young adults, females especially. So the prevalence is very very high. It is not a very small disease or a disease which we should ignore. So if I'll see that it is not a rare disease at all, as I have already told, and many times it is misdiagnosed, so also mismanaged, because it has not a particular presentation, variable presentation, which I will describe. So people may treat it symptomatically, so it can be misdiagnosed and mismanaged. So So far as the diagnostic criteria are concerned, there is a criteria called Rotterdam criteria. To simplify it, I must say that it has three criteria for the diagnosis. Any two of the three criteria, if present in that female, then we consider it as polycystic ovary syndrome. These three criteria are, the first and foremost is the ovulatory dysfunction or irregular cycles. Usually those ladies who are menstruating, they will have some kind of irregular menstruation. Maybe the cycle length will be prolonged, it will be decreased, it will be heavy bleeding. So any kind of irregularity if she has, majority do have a prolonged interval of the cycles, but it can be any kind of irregularity. Along with that, if there is features of hyperandrogenism. Hyperandrogenism means the male hormone which is known as androgen. The androgen expresses in our human body or the female body in the form of excessive hair growth in the face, in other parts of the body, just like males. And there is also kind of production of excessive acne. There will be hair fall, there will be hoarseness in the voice, loss of libido, so many things. So any features of hyperandrogenism or in the blood, the androgen level or testosterone level is raised. That is also a feature of hyperandrogenism. So if these two, or the third one is the ultrasound characteristic. In the ultrasound, if you find polycystic ovarian morphology, that means the ultrasound shows the ovaries are bigger enough from that of the normal counterpart, and if it is more than 10 cc in its volume, either or both ovary, or the number of follicles in one or both ovaries is more than 20 in number of follicles. So either of these features present in the ultrasound picture, we call it is polycystic ovarian morphology. So any two out of these three is considered as the diagnostic point for polycystic ovarian syndrome. So, but there are some myths, that misconceptions among people. If you ask that, do irregular menses means always PCOS? No, it is not always. Similarly, they will also think that PCOD is a different disease and PCOS is a different disease. Already I told, these are both are same. And some people have also they have a concept that those ladies or young girls who are obese, or those who have only hair growth, they can be also PCOS. No. So only if we get two features out of the three criteria that I have described, then only we'll call them as polycystic ovarian syndrome. So I was talking about the ultrasound appearance. So if you'll see this ultrasound picture, you can see this is the ovary, and these are the small follicles where just arranged like a pole around the cortical region of the ovary with a thickening of the stroma. Similarly, in this side also you can see the ovary size has been increased, and simultaneously the number of follicles you can see all around. So it is at least more than 20. So usually we do transvaginal scan and we diagnose this polycystic ovary with, we call it is polycystic ovary morphology by ultrasound. And well, so if you'll see this disease, then it not only affects the young or adolescent girls, it actually, its origin starts from the intrauterine life. When the baby or the female fetus or female child is inside the uterus of her mother, it takes place its origin in the form of genetic influence or any kind of environmental influence. And usually it manifests in the puberty and adolescent. When she become at the pubertal age around 18, 20, or you may say a little earlier. So that is the time when she will have all these features of hyperandrogenism, irregular menses and all. So that is the time when it usually expresses, but the clinical symptoms may go up to reproductive life. As I told, that these are the girls, after marriage, they are unable to conceive. So that means there is polycystic ovary, they develop. And there can also be other features like high blood pressure, diabetes, and so many other complications in the later life that I will describe. And some of them, because of this sequelae, they may have also perimenopausal sequelae, like they will become obese, they may have metabolic syndrome like high blood pressure, heart disease, even cancer. So it starts from the fetal origin, it continues up to the last age or last time or the last life of the female. So it is womb to tomb. If you'll see the dangers or the various some consequences and the long-term health sequelae that this polycystic ovarian syndrome produces, then here, as you can see, it produces hirsutism. That means hair growth in a female. If the males have hair in the face, that is normal, but when it develops in the female, it is definitely not normal. And there will be excessive acne. And if you'll find she'll suffer from infertility, she is unable to conceive. And polycystic ovary, already I told you. So it may produce baldness. Even the nape of the neck, you will find black pigmentation. So the nape of the neck becomes black. They may become obese. So there will be irregular menses. And after all, because of all these things, there will be psychological trauma. She may be depressed on some kind of psychological issues they may suffer from. So all this together, this is the metabolic or the subsequent sequelae or the complications, you can say, of polycystic ovarian syndrome. So clinically, how do they present? Around 75% they present with infertility, 70% are undiagnosed, 87% in later life may develop microbial infection, 80% develop hirsutism, 83% produce acne, and 30 to 40% amenorrhea. So this polycystic ovarian syndrome affects not only the fertility but also her lifestyles, her appearance, and so many things. So also her psychology. So it is something which is very important to know, and so that we can reach to the doctor and we can ask for the treatment. So you can see all these pictures showing the various presentation of polycystic ovarian syndrome. Is not it interesting that only a single defect in the ovary or the associated presentation of the ovary can produce so many health issues? Well, so these are the various pictorial presentations as I already described. So now again, there must be a question in your mind that is it only disease of the ovary? Means whether it is only affecting ovary? Definitely not, because I have already described that so many disease conditions or so many kind of health manifestations. So it is a disease which is beyond ovary or ovarian cyst. So more important in our field, if I'll describe about the fertility aspect, then as a fertility consultant, I must say that majority of our patients who are suffering from infertility may have this polycystic ovarian syndrome, and usually they present because there is anovulation in polycystic ovarian syndrome, so they are unable to conceive because their fertilization is not happening. So these people, when they approach to us, usually we first try to diagnose the exact disease and with the criteria. Then once the disease is diagnosed, then we proceed towards the treatment aspect. So definitely they need some starting from the medication, they may need higher order treatment like in vitro fertilization and all. So fertility is a very important aspect that polycystic ovarian syndrome that affects. So also the dermatological aspects in the form of hirsutism and acne that I have already told, and there is also in the form of anxiety like psychological anxiety, depression, there will be eating disorder and so many things. And if the metabolic aspect is concerned, you'll find there can be obesity and future development of diabetes, heart disease, and so many things, even microbial infection, and there is sleep disturbances, and there is sleep apnea, and there is also psychological depression. So it is not simply a disease of the ovary. That means it is not only confined to the ovary, it is confined, it may be attributed to such a big range of health issues, so that we all of you should be very much means aware about this disease. I must say it is a kind of awareness. So if you'll see the adolescents, that means young girls, so in them the polycystic ovarian syndrome diagnosis is a little different. People usually think the young girls who are not menstruating regularly, they might be suffering from polycystic ovarian syndrome, but that is just a myth. That is not the true, because in adolescents the same three diagnostic criteria is not used. For adolescents, we don't use the ultrasound as a criteria for the diagnosis of polycystic ovarian syndrome. Rather, we use the criteria like hyperandrogenism, excessive hair growth, or increased blood level of androgen or testosterone, and irregular menstruation. If these two are present in an adolescent girl beyond 1 year of her menarche, then we usually consider them as patients of polycystic ovarian syndrome. But ultrasound is not used at least for 8 years following menarche as a diagnostic criteria for polycystic ovarian syndrome. So if it is an adolescent and she is suffering from polycystic ovarian syndrome, then what other investigations usually we can request for her to do, and why we should advise? Because once we have a disease, people usually think about that I will undergo a lot of investigations. Then what exact investigations we should do? So definitely our investigations should aim to diagnose the disease. So usually, first of all, we assess the as I told that it is a metabolic disorder. So to assess the metabolic factors, which usually gets deranged, like the lipid profile. Usually the terminology, hyperlipidemia is being diagnosed by a test called lipid profile, where all the cholesterol level and other factors are being assessed. Also, we do assess the blood sugar level. Either we do a glucose tolerance test or any other method where the blood glucose is being measured or assessed. And along with that, also you can go for ultrasound and to rule out other pathologies or any other disease if at all she is suffering from. Once she is diagnosed, both clinically she is presented to us, and we assessed her clinical parameters by examination. Then we did the investigations. Then after the diagnosis, then the role is not finished, of course, because we need to treat her. So the treatment is usually depending on the symptoms, and then we must know how we should proceed towards the management. Usually I will tell in simple words that the treatment is more often based on the lifestyle changes, because this disease, although I told you that it is polygenic and multifactorial, that means it does not have any single cause or genetic attribution, but it has been seen that this disease manifests, or you can say it gets sprouted because of a deranged lifestyle. Though it is suppressed in our body, but it gets sprouted or it gets explored because of the lifestyle changes. So this lifestyle means defective lifestyles. So by changing our lifestyles to a good or healthy lifestyle, definitely we can suppress or even erase this disease. Then what are those lifestyle changes? That must be our question. So the most important lifestyle change which you usually ask to the patient, or the especially girls and ladies who are planning for pregnancy, is the to lose their weight, especially if they're obese. Then we can ask their body weight or body mass index is more than 23 as per Indian standard, or their means are very heavy weight, either they are in the obese category or morbidly obese category, whatever. So in such situations, we ask them to have regular exercise, so that at least 5 to 10% of their body weight should be reduced in a duration of 6 months of period. So excessive weight should be reduced, so that it has a direct impact on her body metabolism, which not only cures the hyperglycemia, that means the diabetes status, but also it also cures the hyperlipidemic status, that means the blood cholesterol level is also normalized. So it also leads to an improved menstrual cyclicity. It decreases the circulating androgen or testosterone. That's why the hirsutism and acne features are also reduced. And also it reduces the risk of future comorbidities, as I already told, that these ladies may develop microbial infection, even high blood pressure, hyperlipidemia. All these long-term consequences are also minimized. So so far as the management is concerned, I told you the lifestyle interventions are the first line treatment for all polycystic ovarian syndrome. And the lifestyle interventions can be the behavioral strategies, the dietary interventions, the exercise, the obesity, and weight assessment. So the most important, I told you, exercise. But along with exercise, the very important one is the dietary interventions. Then we must discuss that. But you tell what practical dietary advice? The question must be in your mind, that what practical dietary advice will you give for weight loss, and how much exercise actually needed so that she can have an adequate weight loss. So these are the two relevant questions usually comes to our mind. And also what kind of diets that she should take. So this is the kind of dietary advice which usually we recommend, and the dietitian usually they give the exact kind of food usually the person should consume. So there should be there is no single dietary type that I can recommend for PCOS, that it is a PCOS diet. No. So usually we give a diet which is calorie restricted. That means the amount of carbohydrate should be less, and the energy deficits from a normal usual day-to-day food should be 500 to 750 kilocalorie per day, so that she can achieve some weight loss up within months. And if the normal or average calories she requires per day between 1200 to 1500 kilocalorie is usually considered as adequate to produce weight loss in the a person. So usually we give a healthy kind of diet, as you can see in this picture. These are mostly fiber-based food, or these are more of vegetarian or vegetables or sprouts. You can say healthy animal products like egg and fish, which generates less fat in the body, and also the fresh fruits and dry fruits, and so many dietary things that you can get from the dietitian. Or also, as we know, these are the healthy diets. So then the kind of exercise I was talking about, that how much amount of exercise she should perform. So for an adult between the age of 18 to 64, at least 150 minutes per week. The exercise duration means the exercise means actual active exercise in a week should be 150 minutes at least. Or if she's doing some vigorous kind of exercise like gymming and all, so at least 75 minutes per week should be adequate. And if she's doing muscle strengthening activities, then at least you should do it on 2 non-consecutive days per week. So if these are the adolescents below 18 young girls, then they should do moderate to vigorous physical activity, including those that have muscle strengthening activity at least 3 times a week for 60 minutes each episode they should perform, so that they can have a achievable weight, and also their body metabolism will be definitely streamlined. So at least 10-minute bursts or around 100 steps. If you are 1,000 steps, if you are walking is your passion, then you can walk up to 1,000 steps, aiming to achieve at least 30 minutes daily on most days. That means walking is also a kind of good exercise which you should consider. So if it is if it's really wants for a weight loss, especially obese people, then their exercise pattern should be little intense. Instead of 150 minutes of normal moderate intensity exercise, they should do 250 minutes. If they want to do vigorous exercise, then it should be 150 minutes per week. Similarly, other types of exercise should be increased. And if they want to walk, then at least 10,000 steps. For a normal weight category or normal day-to-day healthy lifestyle, we need 1,000 steps per day. But if you really want to lose your weight, then you can walk up to 10,000 steps per day. Well, there are some myths again, so far as the body weight and the appearance of the female is concerned. People tell that these PCOS women, they cannot lose their weight because they are inherently obese. No, this is a myth. Everyone can lose their weight by diet and exercise. So dietary advice and exercise is the only way how the obese PCOS women can control their weight. So then there is a question that what is the role of medicines? Whether if you are telling that yes, she should go for a good lifestyle management in the form of exercise and diet, she'll lose her weight, and her pictures or her manifestations of PCOS will be improved. Then is there any requirement of medicines? Yes, of course. As doctors, we give so many kinds of medicines, but very common medications I will not tell in details, but I must say that usually we prefer to give oral contraceptive pills, or those are we call combined oral pills. Means in the form of estrogen and progesterone combinations, which usually regularizes their cycles. Mostly these are given to regularize the irregular menstrual cycle. So these are low dose based estrogen pills are given. They are good for health, means they have less side effects. So but to achieve the goal of cycle regularity, they should minimum the duration they should take the medicine is 6 months. So if you are taking it less than 6 months, it may not be effective also. So that idea we should also have. And along with that, there are many other drugs that if you see having hirsutism, androgen excess, features of excessive testosterone. In that case, we give anti-androgens, and other metabolic drugs are also used. So those are not I'm going to describe in details, but I'm just giving an overview that how we proceed with the treatment of the polycystic ovarian syndrome. Well, so as a fertility consultant, I must emphasize that how does it affect means fertility, or how it causes infertility in women suffering from polycystic ovarian syndrome. So there are 4 conditions, there are 4 causes for infertility in PCOS has been highlighted here. As you can see, the most important is the anovulation, where the woman is unable to ovulate regularly. Means you know that to have a pregnancy, the ovary need to ovulate a oocyte or a ovum or egg, you can say in a common language, so that it can have a fertilization or mixing with the semen, or you can say the spermatozoa of the male partner. So if there will be anovulation, if the oocyte is not releasing, it is not coming out of the egg, then how there will be fertilization? So the most common type of cause of infertility in PCOS is the anovulation, means she is unable to ovulate. So another is the poor oocyte quality. Even if she is ovulating, the eggs are coming out, but these eggs are very poor in quality because their quality is not that good so that it can fertilize and produce a child. And also, even if there is fertilization, the embryo which is formed after fertilization, the quality is again compromised. So even if it gets fertilized, but the embryo, because of its poor quality, it is unable to grow, so she is not continuing her pregnancy. Even if that embryo goes and settles inside the uterus, that is called the endometrial cavity. But the endometrium, that means the inner lining of the uterus, where the fertilized egg go and sits there, then it grows into its fetus or a baby. But that endometrium is not good enough to give a good place for the settling of the fertilized egg, so that means that pregnancy cannot continue. So many factors which is responsible for infertility in PCOS that we should keep in mind. Then what are the timing when we should consider such women or females that they are infertile? she is unable to produce child. If they are married but they are less than 35 years, especially the female partner, still they are not unable to get the child after 12 months of marriage, less than 35 years, then we consider them as infertile couple, and we ask them for come and so that we can start treatment. But if our age is between 35 to 40, then we will no more wait. We will not wait till 1 year. At least within 6 months they should come to us if they are not having a normal pregnancy or they are not having the pregnancy. Similarly, if she is more than 40 years and she is PCOS, we should not wait at all. Immediately, even after marriage or they want to have pregnancy, immediately should start the treatment, because as the age increases for the females, the fertility decreases. So we should not wait for 1 year. So like this, how the infertile patients with PCOS they come. We usually start screening them and we take their investigations or tests. But one thing what we usually find in case of infertility, when we counsel the couples, we should counsel both male and female partners. It is our practice. Always I insist. Many times we find that female will come by herself and will ask that I am unable to conceive. These are the problems. Then when we ask, where is your husband? Usually they will tell that he is not coming. And sometimes they'll come with some of their family members or friends. But it is an important message to all of you who are watching that whenever a couple gets married and they are unable to have their child, and we should not push the female partner only that go to the doctor and take the medicines for pregnancy, because this is a pregnancy is something which both male and female partnership is required. And if we don't know, even if the male partner is suffering from some disease, some defects in our genital or gonadal system, for which the pregnancy is not happening. So in such situations, always husband and wife should come to us so that we can evaluate individually both of them, and we'll finally find out what is the cause of infertility, why they are unable to have the pregnancy. Then we'll proceed with that treatment. So simultaneous evaluation and treatment of both the partners is very, very important. Then how we should proceed with the treatment of infertile couples if the female partner is suffering from PCOS. So first and foremost, already I have highlighted that weight reduction and lifestyle modification is very, very important. And after that, usually we start ovulation induction and some other kinds of medications we give. Then if she is still not having ovulation and all, so we have different regimens of medications. We put higher order gonadotropins and all. Still, if she is not achieving, then there is another alternative method of operative procedure called laparoscopic ovarian drilling. And nowadays we are not doing much because of its various drawbacks and all. But still, it is an option in specific individualized cases. This method is also opted. Else, when all the methods are failed, the final thing we go for ART, assisted reproductive techniques like in vitro fertilization or ICSI and other things. So along with that, some other medications or other treatment which may require is, especially if she is very morbidly obese, excessive obesity, either we give anti-obesity drugs or we do a bariatric surgery, and all these various methods of treatment can be obtained for those females. Now, the lifestyle modification, again, it is not only the condition or it is not only the treatment for PCOS, those who are not planning fertility, but also this is the most important treatment for those who are planning their pregnancy. So lifestyle modification in the form of exercise and healthy diet that improves the fertility that I have already described. Along with that, she needs good weight loss and her metabolic conditions should be improved so that her fertility will return to a normal or basal level. So at least 3 to 6 months of treatment with lifestyle modifications should be there before we go for the next order treatment, especially young people, and which will improve her health and quality of life also at the same time. Well, once suppose we have assessed the female, we have she's a married female or married woman, and she had PCOS, and we have given her treatment, everything. After that, she gets her pregnancy. Suppose she gets her pregnancy with the medications or with the gonadotropin or even with the first attempt with the IUI or IVF, whatever. But is there our job finishes? No, because even after the pregnancy is positive, these women may suffer different kinds of pregnancy complications that I'll describe. So again, it comes as a high-risk pregnancy. Those women having polycystic ovarian syndrome, when they get pregnancy, it becomes a high-risk pregnancy. Then what are the complications? So here you can see the list of complications. Usually, polycystic ovarian syndrome women, when they become pregnant, they may have early and recurrent miscarriage. This means they'll have they lose their pregnancy. That is called recurrent miscarriage. Even if they get pregnancy, it may not continue. For that also, we need the treatment. there is a high chance of ectopic pregnancy. That means that pregnancy occurs in the tubes or outside the uterine cavity. There can be chance of preterm birth. That means she may not continue her pregnancy till term, means the baby will deliver prematurely. She may develop gestational diabetes mellitus. Already I told polycystic ovary syndrome patients are more prone to develop high blood glucose. So gestational diabetes mellitus will be there. They may develop preeclampsia. That means their blood pressure will be raised during pregnancy, and there will be proteinuria, leading to a condition called, that is one of the very important complications of pregnancy, preeclampsia. And there can also be small for gestational age child. The baby size will be smaller, and there is that means the adequate growth is not happening, and there is chance of stillbirth. Suddenly the baby will die inside the uterus or while the process of delivery also. There will be increased operative delivery, means there will be more chance of cesarean section or using some kind of instruments. So that will also increase the morbidity or increase the suffering of the female. And even after delivery, such babies may require more of an ICU admission, NICU admission. The babies are kept into the ICU. So that is also another expense and burden for the couple. So anyway, so these are the complications. As we know, that's a small for gestational age. These babies, if she's a female and she's delivering, her mother was PCOS, she may develop PCOS in her later life. Again, all this sequelae continues, and it is a vicious cycle, as whatever I told you. And these mothers may develop type 2 diabetes, hypertension, cardiovascular disease in their future life also. Well, so after knowing all this about polycystic ovary syndrome in the adolescent age group, in the young females, also those females who are planning for pregnancy, how does it produces infertility, and also how it continues till the adulthood in the form of microbial infarction, hypertension, heart disease, and cancers also, uterine cancer and all. So at the end, I must say that along with that, we should remember some of the key take-home messages, especially polycystic ovary syndrome and infertility. That means those women suffering from infertility. Like PCOS is the leading cause of anovulatory infertility. I already told majority of our patients in our clinic, fertility clinic, we are PCO patients. Evaluation for infertility should not be delayed in PCOS, but ovulation induction can be delayed. So that is our plan, that how we manage them. Lifestyle modification is the mainstay therapy for all manifestations, means diet and exercise. Lifestyle means diet and exercise, which usually we emphasize them. And if we plan for medications, usually we give letrozole, and this is also a part of our job, that which medications we should start. So, but also while doing the treatment, we are very much worried about the development of ovarian hyperstimulation syndrome. Well, at the end, I must say that cardiometabolic health should be optimized preconceptionally, because if these women are become pregnant, as I told, that there is hyperpreeclampsia, there is myocardial infarction during delivery or at the after delivery also. So all these things should be optimized before they are having the pregnancy and all. So thank you all of you. So this is all about polycystic ovary syndrome, and which is a very important health issue so far as the infertility is concerned. Thank you all of you for watching this live streaming. And if anyone asks to ask any kind of questions or queries, please go ahead. Okay, madam, are you there? Okay, someone has given a question that reason for my hormonal imbalance and PCOD is insulin resistance. FSH/LH is this much, and she has given the pictures of her blood parameters. Well, yes, the reason, if I have not gone into the pathophysiology or the actual mechanism of polycystic ovarian syndrome, yes, the root cause is insulin resistance. Insulin resistance usually we measure by taking the fasting blood, measure the blood sugar level. So if this is deranged, also the treatment is same. We usually give lifestyle modification, and we also give treatments like metformin and other hypoglycemic agents, so that her blood sugar will be normalized. Once the blood sugar is normalized, the insulin resistance is reduced. So many other parameters are also improved, because the FSH/LH, what you have mentioned, that it is deranged. The LH level is usually increased, and the FSH level is usually decreased in comparatively. So what happens? The negative feedback mechanism, the insulin resistance, which causes the free sex hormone binding globulin levels are increased. So now it is reduced. So that what will happen? The estrogen, the level which was initially increased, that will be reduced because of the feedback action is and that deranged feedback action is it is mitigated. So that gradually increase and LH will reduce. So again, AMH is a parameter which usually we consider in case of infertility. So AMH is 9.9 is good enough, or you can say on the higher side. So that means AMH defines the fertility reserve, how much oocytes are reserved. You can say the fertility reserve of that female or the patient whose report is given here. So they are very well. They are there is a good potential to become pregnant in future with good treatment and all. So there will be. I don't think there will be any issue with pregnancy once the treatment starts in this particular. So another question, that since 1.5 years we are trying for children and we covered 10 menstrual cycles but still unable to conceive, kindly suggest me that what rule or rule out the test. Okay, so he has taken for 1.5 years they are trying, and 10 months they have already used. So it depends that not only this is 10 menstrual cycles if you have covered for trying for the children. To covered means it is in the form of natural intercourse, or you are using any kind of medications. That is important. If it is natural or just time intercourse, or have the conception of pregnancy normally, then you can well try up to 12 cycles at least before going to the doctor. But it depends on your age. As I told you, if you are more than 35 years, then you should not wait and you should go to a fertility expert. And I don't know where are you from, but our Oasis branch is also many cities of our country. So you can approach us also, so that we have a standardized plan that we how we approach our patients and start the treatment. As I told, with simple medications, ovulation, induction, you may get pregnancy because your fertility is good, your MH status is good. Yes. Any question? Okay, so I am software employee used to lead a sedentary life since childhood and more from job life. I changed my lifestyle, food habits very much extent and reduced from 56 to 50 over 1 year. And BMI is 22.1. It is excellent. It's I must congratulate you that you have adopted the healthy lifestyle. And but you want that, please suggest me routine and food, especially great. Okay, great during menses, ovulating, and post ovulation. Listen, as I told you that there is nothing called your age is 30. Okay, good. So there is nothing called PCOS diet. So the diet what we prescribed is healthy diet. You should do exercise as you are doing. Either you go to gym, you do some yoga, you do some sports, dance, whatever you like or love. But along with exercise, your diet should contain more of we usually tell fiber based food, more of less calorie, more fiber. Less calorie means and less junk food. Don't consume more of this preserved food, fast food, all these items. You are mostly homemade foods are always preferred, along with less oilier fruits and vegetables, sprouts should be the major component of your diet. Along with that, you do exercise, take the help of a dietitian if you still feel that my diet is not adequate for that. And I'm sure that if you are planning pregnancy, or if you are married, if you are planning pregnancy, that will be a good thing to continue with, because your BMI is very good, so you can try for that. Or if you are planning for marriage and all, I don't think that there should be any issue later. So okay, so is daily white discharge is common with women with PCOD? No, white discharge and PCOD may not be interrelated. So there must be some other causes for that. It depends on your lifestyle, your age, your marital or sexual habits. So many things are responsible for it. Many times it can be because of some infections. Many times it can be just physiological because of white discharge and watery discharge, and in and around the menstruation considered to be the normal, unless there is foul smelling or itching, or it is excessive enough to wet your undergarments and all. So but it is not related to PCOD for sure. Well, any other question? Yes, all of you those who are listening, Thank you very much for watching this live streaming. And I am Dr. Prasanta Kumar Nayak, the fertility consultant from Oasis Fertility Hospital, Bhubaneswar. Once again, thanking you all for watching our live streaming on polycystic ovarian syndrome. Thank you very much. Bye bye.